Hi, this is Mark Struthers and today's presentation discusses the controversy created by the 2024 FDA mandate on mammogram reporting. Remember, FDA is national, but we also have to worry about state implementation of the new FDA mandate on breast density and breast cancer reporting.
1. Inconsistencies in state regulations. Prior to the federal rule, 38 U.S. states had some form of breast density notification requirement, but there were inconsistencies among them. This raised concerns among advocates, including women whose advanced cancer had not been detected on a mammogram due to dense breast tissue. 2. Complexity of screening. The new regulations underscore the complexity around screening for breast cancer in women with dense breasts. Dense breast tissue can make it more difficult to detect cancer on a mammogram, leading to potential delays in diagnosis. 3. Impact on healthcare providers. Some healthcare providers are concerned about the additional burden of notifying patients and the potential for increased anxiety among women who receive these notifications. 4. Need for standardization. The U.S. Congress ordered the FDA to establish a national minimum standard for including breast density information in mammography reports. This move aims to address the inconsistencies and ensure that all women receive the same level of information, but it also highlights the challenges in creating a one-size-fits-all approach. These controversies reflect the ongoing debate about the best ways to balance patient information, early detection, and the practicalities of healthcare delivery. Hi. This presentation was researched and created by Mark Struthers. The Food and Drug Administration, FDA, has recently implemented a new requirement aimed at enhancing women's health care. This regulation mandates that women with dense breast tissue must be informed about their breast density in their mammogram results. The goal of this requirement is to ensure that women are better informed about their breast health and can make more educated decisions regarding their medical care. This change is a significant step forward in the early detection and treatment of breast cancer, as dense breast tissue can obscure mammogram results and potentially delay diagnosis. The preamble to the MQSA final rule emphasizes that all interpreting physicians are the final arbiters of the quality of mammography images, and adds, it is important that they communicate their satisfaction or dissatisfaction with the quality of the images they are provided to interpret to the technologists who produce them. Such communication is the crucial first step in the identification of problems and the initiation of corrective actions. Dense breast tissue can indeed have implications for breast cancer. Here are some key points. 1. Women with dense breast tissue have a higher risk of breast cancer compared to those with less dense tissue. The risk is thought to be similar to having a relative with breast cancer. 2. Detection challenges. Dense breast tissue can make it harder to detect cancer on a mammogram because both dense tissue and tumors absorb X-ray about the same. This can cause the cancerous tissues to hide or blend in with dense tissue. 3. Supplemental screening. Women with dense breasts might consider additional screening methods, such as ultrasound or MRI, to improve cancer detection. 4. Common condition. Having dense breasts is not abnormal or a disease, but it is a significant factor in breast cancer risk. Breast cancer. Abnormal cells develop from normal cells in the breast. Tumor cells have genetic defects that allow the cells to grow too rapidly and to invade normal tissues. 90% of women with breast cancer have tumors due to spontaneous new mutations arising in their breast tissue as they age. The cause of these mutations is not known. 10% of women with breast cancer have an inherited risk for cancer due to genes passed on from their parents. For cancer to occur, something must damage the nucleus of the cell. In a cancerous cell, permanent gene alterations, or mutations, cause the cell to malfunction. For a cell to become cancerous, usually 3 to 7 different mutations must occur in a single cell. These genetic mutations may take many years to accumulate, but the convergence of mutations enables the cell to become cancerous. The latest guidelines for mammography reporting in which the patient has dense breast tissue have been updated by the FDA. Starting from September 2024, all women will be informed in their mammogram results letter whether their breasts are classified as dense or not dense. The letter will also explain that dense breast tissue can make it harder to detect cancer on a mammogram and that it increases the risk of developing breast cancer. Additionally, women with dense breasts will be advised that other imaging tests, in addition to a mammogram, may help in detecting cancers. This new standard aims to provide clearer information to patients and help them make more informed decisions about their health. Breast density refers to the proportion of fibrous and glandular tissue compared to fatty tissue in the breast. Women with dense breasts have more fibrous and glandular tissue, which can make it more difficult to detect abnormalities through mammograms. Dense breast tissue is a common condition, affecting nearly half of all women undergoing mammograms. It is important for women to understand their breast density because it can impact the accuracy of mammogram results and influence the need for additional screening methods. Having dense breast tissue can increase the risk of breast cancer and make it more challenging to detect tumors using standard mammography. Dense tissue appears white on a mammogram, similar to how tumors appear, which can mask the presence of cancer. This similarity can lead to false negatives, where cancer is not detected, or false positives, where non-cancerous areas are mistaken for tumors. Understanding the implications of dense breast tissue is crucial for women to advocate for appropriate screening and follow-up care. Dense breast tissue refers to the amount of fibrous and glandular tissue compared to fatty tissue in the breasts. Women with dense breasts have more fibrous and glandular tissue, which can make it harder to detect abnormalities through mammograms. This condition is relatively common and can be influenced by factors such as age, genetics, and hormonal changes. Understanding the implications of dense breast tissue is crucial for early detection and effective treatment of breast cancer. Dense breast tissue is a common condition, affecting nearly 40 to 50% of women. It is more prevalent in younger women, those with a lower body mass index, and women undergoing hormone replacement therapy. The density of breast tissue can change over time, often decreasing with age. However, the presence of dense breast tissue is not an anomaly but rather a variation of normal breast composition. Recognizing its prevalence helps in understanding its impact on breast cancer risk. One of the primary challenges posed by dense breast tissue is the difficulty in detecting breast cancer through mammograms. Dense tissue appears white on a mammogram, the same color as potential tumors, making it challenging to distinguish between normal and abnormal tissue. This can lead to misdiagnoses or delayed detection, which can adversely affect treatment outcomes. Therefore, additional imaging tests such as ultrasound or MRI may be recommended for women with dense breasts. Women with dense breast tissue have a higher risk of developing breast cancer compared to those with less dense tissue. The exact reasons for this increased risk are not entirely understood, but it is believed that the higher amount of glandular tissue may contribute to the development of cancerous cells. Additionally, the difficulty in detecting tumors in dense tissue can lead to later-stage diagnoses, which are harder to treat. Awareness of this increased risk is essential for proactive health management. Genetics play a significant role in determining breast density and, consequently, breast cancer risk. Women with a family history of dense breast tissue or breast cancer are more likely to have dense breasts themselves. Genetic mutations, such as those in the BRCA1 and BRCA2 genes, are also associated with higher breast density and an increased risk of breast cancer. Hormonal factors significantly influence breast density. Estrogen and progesterone, hormones that regulate the menstrual cycle, can increase breast density. Women who undergo hormone replacement therapy, particularly those taking combined estrogen-progesterone therapy, are more likely to have dense breasts. Hormonal changes during pregnancy and menopause also affect breast density. Monitoring these hormonal influences is crucial for assessing breast cancer risk and determining appropriate screening strategies. Lifestyle and environmental factors can also impact breast density and cancer risk. Factors such as diet, physical activity, and exposure to certain chemicals can influence breast tissue composition. For instance, a diet high in fat and low in fruits and vegetables may increase breast density. Regular physical activity, on the other hand, can help reduce it. Environmental exposures, such as radiation, can also affect breast tissue. Given the challenges in detecting breast cancer in women with dense breast tissue, advanced screening and diagnostic tools are essential. Digital mammography, ultrasound, and magnetic resonance imaging, MRI, are more effective in identifying abnormalities in dense breasts. These tools provide different imaging perspectives, making it easier to detect tumors that mammograms might miss. Regular screenings and the use of multiple diagnostic methods can improve early detection and treatment outcomes. Preventive measures are crucial for women with dense breast tissue to manage their increased risk of breast cancer. Regular screenings, lifestyle modifications, and, in some cases, medication can help reduce risk. Medications such as tamoxifen and raloxifene have been shown to lower breast cancer risk in high-risk women. Additionally, maintaining a healthy weight, exercising regularly, and limiting alcohol intake can contribute to lower breast density and reduce cancer risk. Proactive measures can significantly impact long-term health outcomes. Mammograms are a critical tool in the early detection of breast cancer. They use low-dose X-rays to create images of the breast tissue, allowing radiologists to identify abnormalities. For women with dense breasts, mammograms may not be as effective in detecting cancer, which is why the FDA's new requirement is so important. Effective communication with healthcare providers is essential for women with dense breasts. Women should feel empowered to ask questions about their breast density and the implications it may have on their health. Discussing the results of mammograms and the potential need for additional screening can help women make informed decisions about their care. Early detection of breast cancer significantly improves the chances of successful treatment and survival. For women with dense breasts, understanding their breast density and pursuing additional screening methods can lead to earlier detection of cancer. Early-stage breast cancer is often more treatable and has a better prognosis than cancer detected at a later stage. The FDA's new requirement aims to enhance early detection efforts by ensuring that women are fully informed about their breast density and the potential need for further screening. While the new FDA requirement is a positive step forward, there are challenges and considerations to keep in mind. Not all women may have access to additional screening methods due to cost, availability, or insurance coverage. Additionally, the anxiety and stress associated with dense breast tissue and the need for further testing can be significant. It is important for healthcare providers to address these challenges and provide support to women as they navigate their breast health. Ensuring equitable access to screening and care is essential for the success of this new requirement. The issue of insurance coverage for additional testing for women with dense breasts has become a significant controversy in recent years. Dense breast tissue can make it more difficult to detect cancer through standard mammograms, leading to a higher risk of misdiagnoses. Despite this, many insurance companies are reluctant to cover the costs of supplementary tests, such as ultrasounds or MRIs. This reluctance stems from concerns about the financial burden and the potential for overdiagnosis. However, the denial of coverage for these additional tests could have serious implications for women's health. Dense breast tissue is composed of less fatty tissue and more glandular and connective tissue, which can obscure cancer on a mammogram. Women with dense breasts are not only at a higher risk of breast cancer but also face challenges in early detection. Standard insurance companies often argued that covering additional tests for women with dense breasts would lead to increased healthcare costs and potential overdiagnosis. They contend that the financial burden of these tests could be substantial, and the risk of false positives might result in unnecessary treatments. However, this stance overlooks the long-term benefits of early detection and the potential cost savings from treating cancer at an earlier, more manageable stage. The debate continues as to whether the immediate costs outweigh the future benefits. The denial of insurance coverage for additional testing can have a profound impact on women's health. Without access to comprehensive screening, women with dense breasts are at a higher risk of undetected cancer, which can lead to more advanced stages of the disease by the time it is diagnosed. This delay in diagnosis can result in more aggressive treatments, lower survival rates, and increased emotional and physical stress for the patients and their families. Ensuring coverage for these tests is essential for protecting women's health and well-being. In conclusion, the controversy over insurance coverage for additional testing for women with dense breasts highlights a critical gap in our healthcare system.